Welcome to the Alfi Podcast, episode 19. I got my brother Johnny in the studio.
What up?
Johnny is now 3.5 months after double jaw surgery.
Yeah, a little less.
All right. Last time we did a podcast, I think we were only several weeks out. So a lot has changed since then.
Was it 2 weeks after?
It was 2 weeks after.
Yeah, I just watched that. I just rewatched that video.
Yeah.
They look a little puffy.
Yeah. You feel different, don't you?
A lot different.
It's amazing how much each week changes. From my perspective, seeing patients.
Yeah.
I'm interested to hear the differences week to week now that we're 3 months out. I know that our viewers and patients have a lot of questions about your recovery process. So now that we're 3 months out, let's go through that. You know, the biggest changes between that 2-week podcast and today, what do you think those are?
Before I get into that, I just want to say one thing that did change for me. Working here and going through the surgery, my favorite thing in the world has been talking to patients about the surgery. And I hope I'm not too long-winded with them.
Yeah.
There were patients that kind of helped me with expectations early on. And those patients know who they are, and I'm very appreciative of them. So I hope I'm able to pay it forward and talk to patients and talk to anybody that's viewing this podcast kind of about what my journey was. It's going to be different for everybody.
Right.
But I've enjoyed that so much, talking to patients before they go into surgery, and I hope I vote confidence in them.
Yeah, definitely.
It's been awesome.
So are you open to patients seeking you when they're here?
Yeah.
And asking questions?
Yeah, I hope I don't regret saying this, but they can message me on Instagram.
All right, so you guys,
I try to
heard
answer.
it.
Yeah, I try to be as generous as possible.
Yeah, I know.
So
and I know you're genuine about it.
Yeah, for sure.
All right, so if you guys are listening out there and you want to pick Johnny's brain about recovery, he's a writer too, so he can be pretty descriptive.
I'll try.
About the process. You saw the episode from week 2 recently. What are the things you notice? I'm sure, it takes you back into that space.
Yeah. I was still going through it then. I know some patients had it a lot different than I did, some easier and some more difficult. I had an overall very smooth recovery. Yeah. But 2 weeks out, I noticed how puffy I was. I was feeling tightness and swelling at the same time. I had limited mobility in my face. I wasn't able to chew anything. I was swallowing all of my food. I could go more into that later. I think I touched on that in the last podcast. I had intermittent pain, and not just in one place. Sometimes it was my joints were firing. Sometimes it was around my teeth and my gums. And sometimes that was preventing me from sleeping really well at that time. I think I had some issues with congestion still in the first 2 weeks, especially in the first week, definitely. I had it through week 2, and I suffered a couple nosebleeds, which we also talked about. So that stopped after week 2 for me. So from week 2 to week 6, I had slight discomfort and the swelling and the pain. And then after week 6 is when I noticed I was out of the weeds. I was in the clear, and I was going through life feeling and looking like myself.
Right.
Which was really exciting for me.
Yeah. I know we've talked about this early on. You told me this later, that looking in the mirror was difficult.
It was trippy because the first week, so if you think about it, you're swollen and you're really uncomfortable, and then on top of that, you look in the mirror and you just see this very puffy version of yourself, and you don't know what you're going to look like yet after the surgery. And so that could be...
Were you anxious about that?
I was telling myself not to be. I had faith, but I could really see somebody...
questioning.
It getting the best of them.
Yeah. So you say about week 6 is when you started to feel like...
I had no more discomfort after that. I still couldn't chew. But I started feeling like myself. I started sleeping through the night better. So, because even though I was able to breathe a lot better, I think, just a slight discomfort and the pain would just kind of wake me up earlier than maybe I should have.
Yeah.
But after week 6, I stopped experiencing those things.
Yeah. Also, I think the muscles in the lips and the mouth are weak after surgery.
Mm-hmm.
And I think that contributes to mouth breathing early on. And, a big part of this is you can breathe well through your nose, and you want to breathe through your nose in your sleep, but that's not right away.
Yeah. And actually, I was talking to Susie, my myofunctional therapist, today at a meeting with her, and she noticed how much easier it was for me to keep my lips closed when I wasn't talking.
Mm-hmm.
And I attribute that to what you're saying.
The recovery of the muscles. Do you feel like that's easy, that you have better nasal airflow, that your lip competence is better now than before?
Nasal airflow, I noticed that from the very beginning.
Mm-hmm.
Aside from when I was congested from, all the inflammation of healing, aside from that, it was better, the second I opened my eyes. We hear that all the time from patients, right?
Yeah.
They come out of anesthesia.
They say, wow, I can breathe like never before. I love hearing that.
Right, yeah. So it feels like an open highway. It's unbelievable. It's a different world. The lip competence, I feel like for me, it got better when I got my trays in and my bite started correcting a little bit. I think that was contributing, yeah, because I was slightly open. So I'm on my third tray.
Yep.
And I already feel like that's helping my lip competence.
Good. And when do you feel like your sleep really improved?
It improved even in the first few weeks, I would say.
In terms of quality, but not quantity, right?
In terms of quality, definitely. So I would maybe get 4 hours of sleep, but those 4 hours really did wonders for me throughout the day.
Mm-hmm.
Like my level of concentration is crazy now. I can work from the time that I get up and answering emails and
you're high energy now.
Yeah,
way
getting
more than
writing
before.
down.
I noticed that.
Yep, for sure. And working out and then going home and then continuing working until I go to sleep at 10 o'clock.
Yeah, Erica's here. She was here in the studio.
She was
she
here.
would attest to that.
Yeah, she could. She's even learning the drums. So some things that we do for fun at home is we'll play music together even after we have dinner. We're we're not stopping. So
yeah, that's awesome. I've noticed that. Obviously you work here.
Yeah.
And I do feel like the afternoons you were game over.
Yeah.
Before surgery, and your energy levels. I feel like 5 o'clock I'm winding down, ready to round on patients or go do something, and you're still the computer working.
You're still a powerhouse, man. I don't know if you have the capability of winding down at any time. You'll text me on the weekends.
Yeah, it's hard for me to stop.
Yeah,
I enjoy it.
Yeah. Also, we have a lot going on, which is great
busy.
here. I feel
busy.
like it's
we're lucky to be in an environment where the work is very rewarding, enjoyable, and interesting.
Yeah, for sure.
But to see your energy levels is really nice.
It's been my favorite part.
Mm-hmm.
Yeah, I love it, actually.
Yeah, I know you were working out. You trained for jiu-jitsu competition pre-surgery.
Yeah.
So you were in really good shape, train a lot. Now you're obviously getting back into it. Do you feel a difference in your workouts?
I haven't done jiu-jitsu since the surgery. But what I'm doing now is I'm doing some bag work, some kickboxing bag work. And I hit my PR yesterday in the bench press with Peter.
Oh, really?
Yeah, after the workout, I hit
Amazing.
my PR. Maybe shy to say what it is because maybe it's not that impressive.
Yeah, but that's, only 3 months after surgery, you're not even in your peak condition and you feel stronger.
I feel stronger. I feel, and it's hard. Is it hard to tell how much of that is attributed to the airway? Is it,
right.
It's anecdotal, I guess. I don't, we're not strapping myself to a machine and doing workouts before.
Do you feel like your cardio is different?
Yeah, for sure. because my breathing is different. So when I, really push myself, aerobically, or I guess anaerobically, if I'm sprinting or something like that, I might feel just as tired, but I notice my recovery is way better because I'm actually able to breathe and get oxygen back into my body like way faster and way more efficiently.
Yeah, you feel that.
And Erica's noticed that too. She tells me, "Oh my God, your breathing is day and night." She works out with me all the time. Sometimes she sees me, I look lightheaded, or I used to look lightheaded.
Yeah.
If I really push myself, and now I'm standing there. She can't even hear me breathe, and she's like, "Man, this is awesome. Completely different." Yeah.
Yeah, that's awesome.
Yeah.
I know you're working with Susie for myofunctional therapy. How many sessions have you gone through?
I believe 4.
Okay.
Yeah.
Yeah. What has that done for you? Well, first of all, what is that like? What is the session? And
the sessions are a lot of fun.
Done for you?
I mean, she's such a trip to talk to, you know what I mean? So I really,
is fun.
I look forward to them. I was joking with her today. I'm like, the myo aside, it's great to just be able to sit down with you and talk to you once a week, or once a month, I guess we're doing now. I had general knowledge of what good myofunctional practices are, as far as
oral
mewing.
Posture.
Yeah, oral posture and where tongue placement and stuff like that. But I kind of, I didn't know certain habits that I had that she pointed out. And she's giving me exercises to strengthen my tongue where it's weak and to kind of better pay attention of where I'm placing my tongue in terms of certain words that I'm saying. So she was able to pick up on bad habits that I wasn't able to pick up on my own. And that's just, that was my biggest takeaway from working with her. But she did also, provide other, like, just really good exercises and really good practices. So it's been really useful.
How important do you think that is in your recovery?
For me, especially in the beginning when you're so limited in mobility, because of what you mentioned with, the weakened muscles, and you're stripping muscle off of the bone. So you have to relearn how to speak, you have to relearn how to chew, how to eat. And just when I smile, she'll have me smile and like tell me, what side of my mouth is slightly higher than the other side. So she's so detailed in pointing out what my face is actually doing that I'm not conscious of.
Yeah. That's good.
Yeah.
Yeah. I mean, your recovery has been exceptional. Thankfully.
Yeah. No, thank God.
To be here and see you every day and know that your recovery has been good. It's been really nice.
Yeah. No, I'm so grateful. I'm so thankful. I feel like I got a second lease at life. And I'm honest, I'm not, you're my brother and I love you. I have a million good things to say about you, but it's really remarkable what you did for my life, honestly.
Yeah, thank you.
Yeah. It's awesome.
Thank you. Tell me about your nerve recovery.
I'm glad to say that I have sensation pretty much everywhere, except for there's one place I don't have sensation yet. It's this area of my palate's like just behind my front teeth in the center of my palate. Yeah. It's like.
But you have it in the back.
Right there. I have it in the back. I have it on the sides, and then I was like kissing my fiance and not feeling it for a month and a half or so. That was trippy. That's not fun, right? Yeah. It's like that's an adjustment. I'm sure for her it was a big adjustment. So shout out to the partners there. But
did you notice that?
I would tell her to kiss me up here so I could actually feel it, because my upper lip came back first.
Yep.
How long does that usually take patients to get back?
Upper lip usually takes a week or 2.
Okay. It might have taken me a little bit longer.
Yeah. Lower lip can take a year.
Okay. I have sensation now.
That's great.
So
that's fast.
That's awesome. I could put a cup there and know that, I could feel that it's there. Yeah. And it's more than that. Like I could actually feel now, but it's not back fully. Like it feels different.
How about shaving? Does that feel weird?
Like, you share the same genes as me. We shave and then it grows back 2 days later. So I try not to do it too often. It's just more annoying than anything, but I could feel it. It feels like it tickles. Yeah. It's a sensation, but it's a different sensation.
Yeah. Do you have any discomfort or pain?
No,
Yeah.
no, not anymore.
And I know we took a scan at 3 months. Thankfully, everything is healed
Mm-hmm.
very well. Your bone is healing on track.
Mm-hmm.
We've green lighted you to start chewing
Mm-hmm.
everything. I know that was a big day for you.
Yeah.
What was
been
your
great.
What was your go-to? What was the first thing that you were waiting to eat?
What did I eat? I ate a cheeseburger, right?
Mm.
I still need to eat one with like lettuce and tomato and stuff.
Yeah. So you went for the smash burger.
Yeah. I feel like that's soft chew though. I feel like I could have done that.
What's the hardest thing you've had so far?
I've eaten steak. I've eaten bread. I've been ogling this rosemary Parmesan sourdough at Costco
Mm-hmm.
for the last, 3 months. And finally I was able to put it in the cart and take it home. And with
Nice.
a good French butter and nice jam in the
Yeah.
morning, that's like been my favorite thing to
Yeah.
eat now that I can chew. Is just bread, actually. I
You
miss
feel like
that
you
the most.
enjoy
I
it
couldn't-
more than before?
Yeah.
There's an appreciation for things like that.
Yeah.
Yeah.
Yeah. I mean, a lot of things we take for granted. I think
Mhm.
that's why recovery is can be so challenging,
Yeah.
because even the little things that we do every day that we take for granted, we're no longer able to do.
Right.
Right. So you have to, with jaw surgery patients, we're fortunate that many of these things are temporary. And then
Right.
it's really important to remind yourself of those things,
Yeah.
because
Sure.
it's so easy to get frustrated and to feel hopeless and to feel depressed.
Mhm.
I mean, I try to have a good face. I feel like I have, a pretty positive disposition and discipline to have positive thoughts. But even me, I had bad days,
Yeah.
and I think that if there are patients that are, not practicing those good mental habits,
Yeah.
then I can see how they could have such a hard recovery.
Mm-hmm.
Because, even me, as somebody that's consciously trying to, look at the bright side of things,
Mhm.
value strength, value discipline, and appreciation and mindfulness. Even for me, I had my rough days.
Sure.
You know what I mean? So
That's a good point. Yeah. What advice would you give someone now that you're 3 months out?
to remind yourself of the why.
Mm-hmm.
That everybody has a journey of why they chose this surgery, what brought them into your office, and to speak to you about
Right.
their many issues that they run the gamut of, God knows what,
Yeah.
right? I mean, airway affects people in so many different ways.
For sure.
Right? So
Ways they know that they're aware of and ways that they may not be aware of.
that they're not aware of.
Yeah.
Something I was shy to talk about, but I'll talk about it because I think it's an important issue. And my gut health is like day and night different.
Mm-hmm.
And first I'm like, okay, did the antibiotics completely do a gut reset on me? Because we're on antibiotics for 1 week post-op, right? To
Right.
prevent infection, because we have fresh wounds and we're cut open, right? That's why you prescribe those.
Right.
And then I'm like, okay, maybe they were, so powerful. They hit a reset
Yeah.
button.
It would only probably hurt.
Maybe, but I was
Yeah.
like, maybe, I don't know. Is it the antibiotics? Like,
Mhm.
and then I thought, okay, no, this is lasting, it lasted up until now.
Mm-hmm.
I'm way more comfortable. I used to be regularly uncomfortable,
Yeah. That's amazing. I mean, I think sleep has so many powerful manifestations. Gut health is such an important thing for overall health, but I think there is, a high association by the way you breathe. Obviously, nasal breathing versus mouth breathing, and what that
Mhm.
does for your oral and GI bacteria.
Mhm.
But even more than that is what it does for your immune system to have, a good night's rest and healthy breathing. So I'm not surprised to hear it.
Mhm.
I do love hearing all these. Every patient has different discoveries through their process of things that they improve with, and it's fun. It's fun to see it, but it's, I'm constantly reminded and surprised of how many different associations there are, and
Yeah.
it really encompasses the entire body.
I didn't anticipate that one
Yeah.
at all. So that's a really welcome
Yeah.
surprise.
So I don't know if a lot of the people out there know it, but you're also a musician
Hmm.
and a lead singer for your band. Or you were?
I was. I don't do
were.
it anymore. But yeah.
Have you started singing
I sing
yet?
in the shower now.
Yeah. Have you noticed a difference in your range or singing voice?
Did I talk to you about this?
No, I'm just
really?
curious.
You're just asking me now?
I just thought about that.
Because I was telling Greg yesterday that it's way easier for me to catch vibrato, and I just have like way more airflow. It's a lot easier for me to sing, and I project more.
Really?
Yeah.
But the voice is not different.
Is my voice the same or is it different? It sounds the same, but I probably sound less nasally.
You do sound less nasally.
Yeah.
Better
my
range.
lisp is a lot better.
Yeah, it is. You are more clear now.
Yeah.
That's pretty cool. Because that's a question, I get a lot from musicians. Is it going to change my singing voice? And, my response is always like, I don't know. I mean, we've had so many patients over my 13-year career, and I've had singers, and you hear different things. But most of the time what I hear is the vocal range is improved.
Mm-hmm.
And
the range, that's interesting.
Yeah.
Yeah.
Yeah, but to hear projection and that it's easier to sing, that's pretty cool.
Yeah. Yeah.
That's pretty cool.
Yeah, I have noticed that. Going back, because you asked me what advice I would give to the patients on times that they're having a rough day. Something that I was talking to one of the patients, I think just yesterday, was that, you're gonna have rough days in this recovery.
Mm-hmm.
It's really important to know that they're temporary.
Yeah.
That everything that you're going through is going to change. And one bad thing that you're going through today is going to go away, and you might deal with a different bad thing
but
the
there's
next day. But there's constant evolution.
Yeah.
And it does get better.
Yeah.
So
yeah, I think, it's also a parallel to life, right? And I always like the phrase that after every storm, there's sunshine.
Mm-hmm.
Yeah, but it is true in medicine too. And certainly in surgical recovery, that these things will pass, they will change. But I think you're right to be conscious about them and really, think about where you are in this timeline and appreciate the presence. It's important.
Yeah.
It's important because I can see how people can get really down and out because it is a tough recovery. It's a big surgery.
It's annoying. You know what I mean? Like, that's my best way of describing it. I was just kind of annoyed, like, God, like, when am I going to feel normal again?
Mm-hmm.
And like, whatever normal is. But that comes before you know it.
Yeah.
I'm 3 months out. I feel like a new person. I believe in the procedure even more than I did before, which I didn't think was possible. I was always an evangelist for the procedure.
Mm-hmm.
And I have, only positive associations with it at this point.
Yeah.
All the negative stuff that I went through was inconsequential to what it did for me.
Yeah. Looking ahead, knowing what you know in this 3 months of recovery, how do you think your life will be impacted by the surgery?
That's a really good question. I hope that it adds years to my life.
Mm-hmm.
I know that's kind of an intangible thing.
A lot of variables in that.
It's a lot of variables in that. But again, I think my favorite thing about the procedure is what it did for my work productivity.
Yeah.
And what I'll be able to get done. And I really hope that I use my concentration power for more growth, for more goodness.
Yeah.
Credit to you. I always feel like, we have a culture here that we always try to do, the moral thing, like things that we actually believe in and not to just go through the motions of life. And like, I just look at this part of my life as a journey, this decision was very in line with that philosophy.
Yeah. Yeah.
If that makes sense.
Yeah. Yeah. The Mamba mentality. To be the best version of yourself, to know that this is about health.
Yeah, it's about health. It's about making me, more present in my relationships, a better coworker to, the people on the team here, a better partner to my girlfriend. I sleep better.
Can we get Erica in here on this?
I sleep better. She sleeps better here. Yeah, come.
I want to hear from Erica.
I don't know. Here, let's switch.
Eric, I want to hear from your perspective. Johnny, surprise. Everybody welcome Erica to the studio.
Hello. Hi.
Almost high-fived you.
It's okay.
Erica, any differences you've noticed, Johnny pre-surgery and Johnny post-surgery? Surprises?
Biologically speaking, I hope I'm saying it the right word. Like, I told him, breathing wise, especially at night, when I hear him catch the breath, I could feel that's very hard for him. And he never was able to do like a smooth breath in and out. And then after the surgery, he's able to breathe very peacefully. Like, that's the word I would be able to say. And his productivity, because he has energy.
Yeah.
So even
I've noticed that too here.
Yeah.
For sure.
Even if he doesn't sleep for like 7 to 8 hours, even running on 6, he's still able to function. Whereas before, it would be so hard for him to get through the workday if he's on 6 hours.
Yeah. How about his mood? Any differences?
He's more energetic for sure.
Yeah.
He's always been very positive.
He is.
But like, I think now he's really feeling it inside out.
Yeah.
Yeah.
Yeah. It's awesome. I mean, Johnny's always been a pleasure to be around. Everybody that knows Johnny.
Yeah. I think I'm biased,
knows that.
right?
Yeah. I am too. I am too. But, looking not only as my experience with Johnny, but knowing his friends and everybody that interacts with him, he's always someone that draws good energy, right? And you want to be around him. But I feel like there's more of that now. Like, Johnny's more present. He's even more positive than before. That's been my grasp on you.
Yeah, I like that. Months. It's almost as if with a better airway, with all the benefits from the surgery, he's able to unleash fully who he is.
Yeah.
Yeah.
Yeah. He's a beast.
Was that a bummer before the surgery?
No, we're just saying, you always had it. Everybody wanted to be around you.
No, I feel like now it's like the flow is so much more fluid now.
Yeah.
Because before, I think you would have to, when you're tired, really push through.
Right.
But now it's so natural. Like, it's in you to have that energy come out.
Yeah.
Yeah.
That's awesome. All right, I think that's good. We'll leave it to the audience if we want to bring Johnny back for any more questions, maybe at the 6 month or 1 year mark, see what else we discover.
Okay.
This was fun because I'm just asking you stuff that I haven't asked you before.
Yeah.
I think it's interesting to hear what you've been through. I really appreciate you being candid about this.
Yeah.
Erica, thank you for jumping in.
Oh, no, thank you.
and
Surprise.
giving input. Erica, who's the best basketball player of all time?
Kobe.
Yeah. She belongs in the family.
We have to we didn't watch any Kobe highlights lately. No. I think I keep telling her, we got to watch Kobe highlights, got to watch Kobe highlights. Like, you forget how good this guy is.
Yeah.
And we watched the Scottie Pippen interview yesterday, and now my YouTube is just
basketball
the algorithm
highlights.
is just like 90s basketball
That's all
related.
I get too, and I love it.
Oh my God, so good. Yeah, so much fun. So yeah, we'll get her.
Need to up my knowledge about Kobe.
Yeah, that's awesome. All right, thank you guys very much.
Thank you.
Yeah, for sure.